transition that an issue that I would like to share with you and your people is that the medical system here in Canada is public. They're not private clinics, so parents really suffer a lot from the other side. When their children get sick because the attention is not immediate, or you cannot pay to go to a private clinic to get immediate attention.
Mm-hmm.
So they have to wait until the symptoms evolve. And then once the symptoms evolve, then they can go to the doctor, and then the doctor can prescribe eventually an antibiotic. In other cultures, people go to off-the-counter, medicine, and even they can easily get a prescription and then take antibiotics right away.
Yeah.
So that is another big difference, and I try to contain the parents and try to explain over and over again that they must rely also on.
You're being so nice, so politically correct. You try to explain the unexplainable. I can't get over it. I think, and I know you can't speak up, but I can. I think the health system here is so bad. And I know that most people are going to get mad at me for saying this, but it's great. Honestly, it's great. If you are a drug addict, if you are trying to commit suicide, it's amazing. They will rescue you. They will send lots of cars and ambulances, etc. right away. I know I lived in Chinatown for a few years, and it's amazing. But if you actually have a chronic problem and you need to see a specialist, good luck. Good luck. We have friends, for example, refugees from Ukraine, and the mother has a problem. Well, her son has a problem. He's 3 and cannot say a word. She needs to send him to specialist. Okay, she has to wait 9 months.
Mm-hmm.
Well, 9 months? And my wife now, a few months ago, she needed to do an, what's the name of that? Well, she needed to get a test done.
Mm-hmm.
And then she would have to wait between 3 and 9 months to get a test done.
Yeah.
So we decided to just go pay $1,000 and go and do it. And then she did it within, 4 days.
Yeah.
And I get so frustrated seeing a lot of people coming from Brazil, from Russia, a lot of people from Russia, from Korea, from China, even from India. If they need to go and undergo a surgery, for example, or go see a doctor or specialist, they go back to those countries and come back a month later. It's insane. Even for cancer, plastic surgeries, etc. Plastic surgery is slightly different, but we have a friend who just came back from Mexico. So we could talk about this forever, right?
I have simplified the problem as the public system, the MSP in our province is fair because it's fair to everybody, but it's inefficient. Fair, but inefficient.
Inefficient, yeah.
So and then I think one of the issues here is a problem that was set to happen sooner or later, because first of all, if you have qualified professionals and doctors coming from other countries, they cannot be doctors here. Why? Because they have not graduated here. They don't have the Canadian experience. And then there's always like a kind of a suspicion that if you're graduated from another country, you're not as qualified as people that have locally, graduated. And that's an issue. That's an issue. To me, it doesn't look really fair at all. It doesn't look equitable across the board. It's actually a missing big point here, because if we're looking at the knowledge, why don't you evaluate the knowledge? If you're looking at the experience, why don't you evaluate the experience? If it is English, why don't you evaluate English? And then why are those things not done? That's my question. So it's kind of like excluding other professionals from entering the Canadian workforce. And that is a larger issue and problem that we're missing, highly qualified people entering the country and working immediately, transitioning from their countries to our country.
Yeah.
When I think it's a question of, evaluating those issues, solving them, trying to find a solution. And I personally would not mind to be, going to a doctor that is from a foreign country. I live myself in other countries, and I think doctors are highly qualified in other countries as well. And, they're culturally approachable as well. And they spend a little bit of time with you when you're trying to explain a problem. You don't go for one problem only. You go for your overall thing. You don't need to make another appointment to go for a second problem. So to me, it's really broken and segmented and unfair and excluding other professions. And I'm being politically incorrect right now with you. My father is a doctor, so I know I lived medicine at home from childhood. So yeah, it's kind of like one of those weaknesses as a country and strategic weaknesses as a country. We're missing out on good quality experience, knowledgeable professionals from overseas, immigrating and then transitioning into Canada, and they would contribute to this country right away.
Mm-hmm. So to make clear, they are coming, but they're just not having
driving cabs.
But they're not having their qualifications and experience validated, right?
Yeah, we prefer to have a profession, an engineer driving a cab.
Yeah, that's
because he's not qualified. It doesn't have the experience. It's really segregatory. The rules are set to be segregatory. And that contradicts what we stand for in Canada.